Welcome to Legal Eye on Health, your insight into health law, the ultimate podcast for unraveling the legal intricacies of managing a thriving medical practice. Join us for a deep dive into health law, specifically tailored for providers. Hosted by Dr. Katie Gilbert Spear, a seasoned health law attorney and practicing optometrist, as she brings her unique perspective and passion for empowering fellow practitioners. Together, we'll tackle the pressing issues confronting providers daily. Welcome to Legal Eye on Health.
Are you looking for a nutritional supplement to help with your day-to-day vision needs? Look no further than MacuHealth. Recommended by doctors worldwide, MacuHealth offers a full line of products designed to support your vision and eye health. Available through eye care professionals on Amazon.com and directly on our website at MacuHealth.com. Use the code LEGALEYE when ordering directly from MacuHealth for special discounts. MacuHealth, nutrition you can see.
Hi, everyone. I'm Dr. April Jasper, and I'm here with Dr. Katie Spear, and we are going to talk more about health law. Yes. So I'm not the attorney. I think you all know that. I'm just an optometrist, but I love that Katie's here and willing to help us all learn. And, you know, the last time we spoke, if you didn't listen to the last episode, we talked all about the doctor-patient relationship and when it begins.
Yes. So go back.
Right. Go back and listen to that, because then this will make more sense. But now I think the next best thing to talk about is, how do you terminate that relationship? And so I guess maybe we should back up a little bit. Where should we begin this conversation, Katie?
So I think we need to talk about it in terms of what's your duty.
Okay.
Right?
Yes.
So we started with malpractice last week. Just the tip of the iceberg on, like, how do you have malpractice?
Right.
And we discussed that to have a malpractice claim, you first had to have a doctor-patient relationship. So when does that form? Right?
You can't sue me if I never saw you. Technically.
Actually,
go listen to the last episode.
It all depends. It's like attorney's favorite words. It depends, because there's so many nuances. But, you know, if you don't have a proper formal doctor-patient relationship, you can't have malpractice. Yeah. So you've got to. But once you actually have that relationship, now you have a duty. You have a duty to your patient to provide the current standard of care. And then you also have a duty to be available for urgent and emergent issues that patient may have. Wow. And then this duty continues until it's terminated, until the relationship is terminated. And that's where I think a lot of us do well on standard of care. We know. We go to our CEs and we know. We'll talk about standard of care later, because there are some challenges sometimes. But in general, I would say that we do a really good job providing a good level of standard of care for our patients. I think most of us do a really good job of being available for emergent and urgent issues. But we just need to remember that if we don't properly terminate our relationship with patients, we can have major issues, and you can have claims of abandonment, and that would not be good. So
let's talk about that, because I think that is a little bit scary, because yes. I don't know. Again, it comes back to definitions. You're teaching me. Right. Definitions matter. Yes. And they will if you're ever sued. Right. So how do we start that conversation?
So it's typically, you know, your availability and how you terminate the relationship is usually based on state statute once again. Okay. State statute, and then in some cases, you know, case law that's been determined in that area. So it's hard, you know, I'm talking about it generally. That's why, you know, you shouldn't consider this legal advice ever, because it really depends on your situation and where you are. And I am only licensed in a few states, so I don't know every state. Only a few. And so I can't speak to every state. Right. And so this is not legal advice. Can I say that again?
Yes. And I think that's important for people to know. And they do. Sometimes what people will do is they will take one word. Yes. And they will then build an entire decision-making process from it. And what you're saying is, and I think it's well said and understood hopefully by everyone, is these are just little snippets that we're pulling out and saying, think about this, think about this, think about this. But if, unfortunately, anybody ever is in a situation where you have a challenge, you need to hire someone to help you understand the entire case that you're in the middle of.
Right. Correct.
Okay. So terminating the doctor-patient relationship. There's many ways this can happen. The doctor can terminate it. The patient can terminate it. Talk to me about those.
So the patient can terminate the relationship for any reason at any time.
Meaning they're allowed.
They're allowed.
It's their
They
life.
don't have to ever come back to you. They don't have to get treatment from you. They don't have to get treatment at all. We'll talk about that later too. Can you refuse treatment? But you need to make sure that if a patient does not want to return to your office, they don't want to follow up with the care that you've given them, you need to make sure that they understand the risk of not following up. So, for example, I feel like this comes up sometimes. Say you have a diabetic patient and it's time for their yearly, dilated fundus exam, and your staff's calling saying, "Hey, I need to get you in for you're due for your exam." Right. And the patient says, "Oh, I don't want to come in for that. Maybe they say I'm being seen somewhere else." Great. Then you need to document that. You need to make sure that they educate the patient and they document that education, that they told Mrs. Jones that, great, you're going to see some other doctor. That's wonderful. Remember, you are a diabetic. You have an increased risk, of having a retinal problem. So we want to make sure that you're well taken care of. So make sure you get your yearly dilated eye exams. And, if you ever need anything from us, then, let us know. But at the same time, just got to document it.
So the reason I keep saying wow is because how does your staff even know that patient was diabetic when the electronic medical record is separate from their practice management record?
So you need to have that. So when we do recalls, it goes to the whole recall system, right?
Yeah.
So our recalls are different for our patients that may have a higher risk of retinal disease or eye issues.
Glaucoma,
like if I've got a glaucoma
AMD.
patient, AMD or whatever, they're different. We run those reports periodically to make sure that our hope is that when a patient, doesn't come in or doesn't follow up, that we're doing that properly to begin with. But if we miss a patient, our safety net is to pull a report, see what time, what time frame they were in last, and start calling. And, and you've got a duty to, obviously, hopefully in your record, the last time you saw the patient, you documented well, that you need to come back in and follow up and all that. But if a patient says, wow, I'm not coming back to your office, I've moved, maybe I moved to somewhere, and then you need to formally dismiss the patient.
Right.
You can't, document it, but document that you educated them on the risk of not following up somewhere else, and that they understand that your doctor patient, they can reestablish it. Doesn't mean that they can't come back. Right. But you don't want them hanging on your, watch, basically.
Right. Okay. So that means, the patient can terminate the relationship by saying, or by just not showing up.
Right. Mm-hmm.
But if they have any potentially blinding disease or disease that could be progressive, then we have really the requirement that we have to follow up and make sure that they're being cared for.
Right.
Or maybe just one more time. So what we do in our practice, tell me if this is okay. We, for our glaucoma patients at least, we send them a certified letter, and my time frame is typically 1 year that we'll run that report, send them a certified letter telling them that one more time, even though we've documented it, that you can go blind from this disease if you're not cared for, and telling them they need to come back in.
Right. Yes.
That's
certified
something.
Letter. Yes. So I give patients three times and you're out. So we'll try 3 attempts to get in touch with them over the phone. Sometimes you're able to talk to them, you document it, but I give them 3 shots to come in, and then I send a certified letter terminating I send a certified letter saying we really want you to come in if I can't get them by phone.
Yep.
And then we wait, and if they don't respond to that, then it's a termination letter.
Okay. Okay. So let's talk about what that looks like. So what do I need to document? Tell me more.
So whoever's calling, they need to be well trained. And I think that's sometimes where we miss in our practice, where we, maybe put the newest person at the front desk who maybe not, who's recalling patients and things that they may not understand. So oftentimes if I will give this to my technicians in their downtime to call, because they understand these patients, usually they have a relationship with these patients. So it works well for them to call and try to get them back in. But regardless, or even if a patient calls and says, I've moved on, I'm going somewhere else, you need to document, patient called the office, stated they did not want to be seen at this office anymore. We educated the patient that they have diabetes and that they need to have a dilated fundus exam every year. Patient voiced this. And then you can follow follow that up with a letter stating that, and then it's done.
Okay.
And then make sure you scan the letter in, right?
Yeah.
Sometimes we forget about that.
Exactly. And that works for our glaucoma patients, diabetes, whatever their issue is, whatever their medical condition, follow that same process.
Now, the thing is, if you're going to terminate the relationship yourself, like the patient hasn't,
they're not being compliant.
right. Now you can terminate. So the doctor, you can terminate the relationship too. You don't have to see a patient. However, if you've already established the doctor-patient relationship, you have to do it you have to terminate the relationship in a certain way. And one of those, you need to send a certified letter, a return receipt to the patient stating, we're terminating our relationship. This is why. These are your conditions that you have. We suggest you need to you need to establish a relationship with someone else.
Right.
You have to be available though, depending on state statute. It's usually 30 days. You have to be available for that patient if they have any emergent or urgent issues within that time frame. And you state that in your letter. We're available for your care for the next 30 days. And then in that letter, you need to put, 2 or 3 people that they could go to, other eye doctors in the area that they could.
Okay.
And you can ask, they can pick up their records, or you can send the records to that other doctor. But that needs to all be in the letter.
And would the same thing apply if you decided at one point you weren't going to take an insurance plan?
Yes.
That these patients might be on?
Right.
So walk me through that.
Same thing. You would have to officially terminate the relationship if they didn't want to pay out of pocket. Say,
right.
Hey, we're no longer taking your insurance, but you have to be available for those urgent. Doesn't mean that if you're not taking the insurance anymore, they would have to pay out of pocket, right?
Right.
But you just have to be available for them if they do have any types of eye care issues during that time frame. That typically it's 30 days, but it can, that can vary based on state statute. That can vary based on the insurance that you've contracted to say, I'm going to see these patients.
Oh, that's true.
Yours.
Could have been in the contract.
Yes.
Okay.
Remember, that contract's long. Do you read yours?
I do. I do.
And that manual.
Exactly.
And that manual changes, doesn't it?
So take me back then to the whole, we're talking, how do you terminate the doctor-patient relationship?
Right.
Now, let's say you didn't do it correctly. What would you be brought up on charges technically for? What would you be sued for?
It's the case of abandonment.
Okay.
So if you don't provide, if you're not there for emergent, urgent issues, so like, for example, if you go on vacation, say you want to take a month-long vacation in Europe, which would be awesome.
That would be
amazing. One day, right? Say you wanted to do that. You can do that, but you've got to have somewhere that your patients can be seen.
Right.
You've got to have somebody who's going to see your patients for you. And then based on your state statute, once again, statute or rule, that would determine what type of care you needed to provide. So for example, in Florida, we have a rule that states that you have to be available for emergent and urgent issues. It's in our optometry rule. And it clearly says in there that, using an emergency room as your emergent care is not acceptable.
Okay.
So you can't just say, oh, well, I'm on vacation in Europe for the next month. Go to the emergency room if you got any, if you start going blind or whatever. That's not going to work. You've got to have somebody who's basically taking call for your patients while you're out of town. If not, then it can be a case of abandonment.
So let's say, and this question actually came up the other day. Somebody asked me specifically because we talked about the Florida statute. All right. So the specific question was, I'm out of town. I gave my patients a phone number for another eye doctor. Mm-hmm. Now, do I need to make sure that they got an appointment? Do I have to follow up and make certain that they didn't tell them, no, we're not going to see you? At what point?
Oh, no. If you made arrangements and that doctor refused to see them, then that would fall back on you, because it has to be someone that you have an arrangement with that's going to see the patient, that has said to you, maybe you have a mutual agreement, right? That says, okay, when I'm out of town, you're going to cover call for me. And when you're out of town, I'll cover call for you.
Okay.
But those patients now technically become their patients.
Okay.
And so now, because you're the one that did this was your patient, and you established this care with another doctor, it would still, it could, I wouldn't say it will.
Right.
It would have the potential to fall back on you.
Okay.
If that doctor didn't.
Okay. So any other examples you can think of, Katie, where this doctor-patient relationship termination is?
So the big thing too is to make sure that you give them proper time to find another doctor.
Okay.
And like I said, that would be, it's typically 30 days, but it could be longer. And there have been cases where if a patient had an issue and the doctor refused to see them, but it wasn't long enough for them to establish care. So typically you also really can't terminate a relationship if you're like in the middle of treatment. So it would be really hard to, like, say you're in the middle of treating a patient for a corneal ulcer or something that, you know, they're being seen repeatedly for every few days, and then maybe a week, you know, however long it takes to really finish up the treatment for that specific thing. It would be really difficult to terminate the relationship in the middle of that, right?
Yeah.
Or to start it.
Nobody's going to think that's right.
No. You finish up whatever care it is, you know, that urgent or emergent care, and then after that, you could, you know, properly terminate it.
So I think really the lesson for me in this and everything we've talked about in this episode is to make sure your team understands those rules, because they're the ones that I think will get us into trouble here, don't you?
Oh, definitely. I've got cases. I'll bring them up maybe next
Ooh.
time. Specific optometry cases where the team, you know, or ophthalmology too, cases that where the team really got the doctor in trouble because they doled out advice when they shouldn't have, or they didn't get the patient in when they shouldn't have. So for example, saying, you know, we're booked out for 3 weeks. Sorry about your red eye. Can't see you. If they're your patient,
you have to see them.
And if they suffer damages because of your inability to get them in properly at the proper time, then you're going to have it. You could have an issue.
Yeah. I think if I were listening to this, and for all of you who are, I would almost be making a list of things right now that are, what is it that some people say that are not negotiable items that your team has to know and has to follow and abide by, because if they don't, you're all going to get in trouble. And I hate to say it, but I've been to offices where people have not made appointments for patients because they want to go home. And the end result is somebody can go blind. And so that is definitely on my list of non-negotiables. And I think as we go through this, you and Katie and I together, you're going to see that there are several of those. And it's important that you write them down and just keep reminding your teams, because after all, the patient is who we care about the most. And we want to protect them and protect us.
Yes. Well said.
Yeah, thank you, Katie. See, I'm listening. I'm learning. I love this. And I don't even have to go back to optometry school or go to law school.
No.
But seriously, thank you for sharing with us, because these are things we don't think about. These are things that will get us into trouble, and we just go about our day. So what you're doing here is so important. And I just want you to know that I appreciate it tremendously.
Thank you.